I saw Tyler Summers for a neuropsychological evaluation on August 12th, 2013, and I had the opportunity to spend the day with Tyler. A neuropsychologist studies brain behavior relationships, and we use neuropsychological measures, which are a group of tests that are designed to assess various aspects of cognitive functioning. And they are tests that have been standardized and administered to thousands of people in the exact same way. And it provides information about an individual's memory, attention, problem-solving skills, language skills, fine motor skills, and executive function skills. Tyler's neuropsychological test results showed concerns with processing speed. That is, he processes information at a slower rate than other individuals his age. And we also saw difficulties with attention, particularly related to impulsivity, as well as problems with problem-solving skills. The problems that we saw in the neuropsychological evaluation are related to Tyler's traumatic brain injury. People who have had traumatic brain injuries, and Tyler included, can have difficulties with irritability and at times agitation, and some of that is related to their lack of insight into their challenges and the fact that here they have more people looking at them and looking at the challenges that they're having, and they're not seeing those problems, and so they can become very frustrated with that and may not see the need or the importance of having rehabilitation therapies or going to these doctor's appointments or having extra supervision. At the time that I saw Tyler, it was August, so he was just going into his senior year in high school. And one of the ways that I had seen the difficulties in terms of his deficit awareness is that he really felt, and this is common in adolescents his age, that he could go back to school and everything would be very similar as to what it was before the accident, and wanted to take a statistics course. And while that's something that he may have been able to handle prior to the injury, I did have concerns because of the assessment results of his ability to perform at a level that he probably expected, or that he may have performed at before the injury. Because of Tyler's challenges as a result of his traumatic brain injury, I do have some concerns about his ability to go to college in the fall, and I think that care needs to be taken when we consider his future because of his reduced insight into his deficits and some difficulties with judgment. There are concerns about his transition to adulthood.
This is just a plain film of the pelvis, and so again, all we're seeing is the bony pelvis and a portion of each proximal femur, hip, and the low lumbar spine. On this plain film, we can see a disruption of the superior pubic ramus on the right, and also faintly visible, and maybe you have to be a radiologist to see this, but there's a lucency through the sacrum, which is the back part of the pelvis. So this indicates fractures to the posterior and anterior pelvis, indicating that the bony ring that is responsible for weight bearing has been disrupted, and that's potentially an unstable injury, painful and difficult to recover from. Here's that fracture line that we saw. You can see the white is the bone, and this is the fracture line through that sacral vertebral body. It is mildly displaced. This is sort of the very bottom of that injury. There's a line through the lateral and bottom portion of that sacral ala. That's on the left side. And we can see a fracture involving the lateral aspect of the right superior pubic ramus. And there's that line of the inferior pubic ramus down on the bottom of the bony pelvis. The inferior ramus, he has fractures both anteriorly and posteriorly, and there's a non-displaced fracture on the left as well. So the bony pelvis has been disrupted. The bone is in the process of healing by this point, but that particular injury will cause difficulty with weight bearing and walking.
It's just been an awful experience. Can't even explain, I've never had this emotion in my body ever. The numbness has actually gone away, but it's not a feeling I ever want to feel again in my life. I never want to see anybody go through what we've gone through.